Hi YouTube. This is my first video ever, so I guess we'll see how this turns out. But I'm here today to talk about being diagnosed with a very rare cancer called Adenoid Cystic Carcinoma. And my cancer is in the lacrimal gland. I have since had the tumor, the lacrimal gland, and actually part of my bone here removed, so that it could go to pathology, of course, to make sure that we knew exactly what type of malignancy we were dealing with. But it's been very interesting dealing with this because I just turned 40. I had been looking forward to 40 for a very long time, actually. And I have and had to have, all of these wonderful things that, I'm just expecting out of life, out of my life, for the upcoming years. And cancer was just not on my things to do list. But that's okay. We just move onward and forward with this. A lot of people aren't familiar with adenoid cystic carcinoma because it's a very rare cancer. Out of the 566,000 people that are diagnosed with cancer every year, only about 1,200 or so are diagnosed with this type of cancer. And of those 1,200 people, very few are diagnosed with a presentation in the lacrimal gland. It's usually found in the throat or the mouth, common places for salivary glands to be. It's a salivary gland cancer. This cancer also has, there are 3 subtypes depending on the types of cells they find in the cancer. And mine is rated a grade 3, or a basaloid or solid form, which makes it a little bit worse. The prognosis for this one is, not as great as the other 2. But, it is what it is. We're moving onward and forward with this. My life is full of love. I have a wonderful support system. I have beautiful people in my life, and I expect good things out of this no matter what. I'm scheduled to have radiation therapy starting on December 29th for 6 to 6.5 weeks, depending on, how the radiation oncologist feels about how things are going. With that surgery, I can expect to lose my eye because a lot of the radiation is going to be centered around my orbit here, which is where the cancer was found. And this type of cancer has a propensity to travel through bones and nerves. So, of course, with it being here in my lacrimal gland, there's a great chance that it could metastasize to my brain. And this cancer is known to metastasize throughout the body. People that actually do survive this type of cancer, they live years of finding it in other parts of their body. So, let's hope they get it all, and, let's just be prayerful that things will go well. I'm upbeat about it. Although I do have moments of sadness. I have lots of moments of sadness because, I have daughters that are 17 and 18 years old. Their lives are just getting started. They're going to go to school or, do something. They're going to get married. Hopefully they're going to have kids and they're going to raise them. And, I want to be around for that. I want to have grandkids. I'm really excited about that. And, the thought that this cancer, that this sickness could take that away from me, it makes me sad sometimes. But at the same time, I'm hopeful, I'm prayerful, God knows best. And I'll be talking about this a little bit more as time goes on and I go through therapies and such. I know there are lots of natural things that I could also do to fight cancer, and I'll be talking about those things too as I try to discipline myself to do them. But I appreciate you listening, and I'll be talking about this a little bit more because so little is known about this. There's not a lot of research done on this type of cancer, and that needs to change as well because maybe we can come up with better therapies that work, because chemo is not used on this type of cancer because it hasn't been shown to work, and radiation, which is what's commonly used and the standard, along with surgical removal, even that it's not a cure. It just kind of stops it for a while. So hopefully we can find out more information about this, and I hope through my journey, other people that are dealing with this type of cancer will find a way to handle it better. Thank you for listening.